hey, she showed up. Okay? But she did call Friday and said she was coming. But if it happens, you just call right away. Okay? And we will get there as soon as possible. Now, a lot of times, if we're all spread out all over the Bronx, because we go to Bronx, Westchester, Yonkers, we go everywhere, the patient may have to wait. Now, like you talked about before, I'm going to show you in a minute. Monty now is using a system that can be used right away. Okay, and I'll show you that in a moment. It's used in all our emergency rooms, and it's being distributed throughout different departments. So you may give them that option. Okay, we'll talk about that in a moment. Okay, I see a lot of questions. One more, and then I have to move on to another scenario.
Can we use family member as a...
Good question. Okay, let's talk about that. I'm glad you said that. That'll be our last scenario. Patient comes into your area, and patient's deaf, and they bring someone with them. And they get it across to you, whatever means they use to get it across to you, I don't want the hospital interpreter. I want this person who I brought with me to interpret for me. Do we allow it?
No.
Are you sure?
Yes.
Yeah. Okay. Again, let's talk about it because of the sake of time. Let's use yourself for an example. You're competent. We're all competent adults here, right? All right. Okay. Just check it. You go to the doctor. You're sick, and the doctor says to you, "I want you to take this medication." You have the right to say what? No. You have the right to say no. I don't want that. Right? Okay. Deaf person is saying to you, I don't want the hospital interpreter. I want this person. Do they have the right? Yes. Yes, they have the right. They're saying, just like you are saying no to something, they're saying no to something. Okay? So they have the right. But, we're going to try to discourage you. Why? Now I want to hear from you. Why? What problems can come up with having this person interpret? Okay, wait. 1 minute, please.
The interpreter can say things on what they want for the patient and not necessarily what the patient wants for themselves. And it could also be a confidential issue as well.
Okay, so you named 2 good points. Very good. Let's start with the first one. This person may say things that, let's put it this way. It happens many times. They've done studies based on what you said. If the person interpreting is emotionally attached to the person they're interpreting for, they may change the message. Especially if it's a message difficult to accept. They may change the message. Or they may start to make decisions for the patient, not even allowing the patient an opportunity to hear what is even going on. Okay, very good point. So that's one good reason why we're not going to allow that. Now you raised another one. You said HIPAA, right? You said privacy violation. Couldn't that be a problem?
Yes.
Husband comes in, he's deaf, he brings his wife to interpret. Oh, I'm sorry, sir, you're HIV positive. Well, wait a minute, wait a minute, I didn't want her to know, wait a minute. Well, you shouldn't have brought her, but you can see it could raise some problems, definitely, okay? Good, you raised 2 good ones, please.
So do you have them then sign a disclosure form or have somebody kind of witness that? Because if they're going to give, you're interpreting, they're going to give false information, God forbid they drop dead, you were trying to tell them the right information, right? Is there, because then they can go back and say, well, that's not what he said, and then you have no proof, right? Somebody said that earlier here. You need to have some proof, some documentation that written down that I would say, so how does that work? Do you make them sign some sort of disclosure form, like, okay, you're declining? Because if a doctor tells you, okay, you got to take this medication, you decline, they make you sign something. They write on there, the patient declined, date, whatever, goes into your file. Is that the same for hearing impaired? How does that work?
What's your question? I got you. Because you painted the whole picture, which is beautiful. It's beautiful. Okay, in that situation, if they're insisting, now, you're going to do what? First of all, you're going to do what?
Call Bill.
You're going to call? Mike, what's the matter with that? I was like, no, you're calling interpreting. Good. You're calling interpreting service. Okay. When we come, I'm going to use you, especially if you're the staff member, and you're going to explain all that to the kids. You're going to tell them the dangers, okay, and some of the other things we're going to talk about. You're going to talk about the HIPAA violation, possibly. You're going to talk about how, the first thing you said, they can change the meaning. Okay, we're going to talk about all those things and explain that to them through the interpreter so they understand clearly what's being said. These are the risks if you use this person. Now, if they continue to insist, I don't care, I want this person, then we're going to have them sign something to release Monty from liability. Okay? And then, at that point, I'm going to leave. I'm going to leave. Because now, they're on their own. Okay? They're on their own. We've explained to you the risks. This is what could happen, and we're very thorough. We explained it. Now, do you still want to use this person? Fine. I have a place to go. Okay? So I'm glad you raised that point. Thank you. Can you think of some other problems that can come up with using this person? I'm trying to look for new hands. Please. Excellent point. She said medical terminology. How do you know that this person can interpret, is even qualified to interpret, especially medical things? You don't know. You see them doing stuff like this, you don't know. You don't know what they're saying. You don't know. I mean, just to use myself as an example, when I got hired here, I had about 7 years of experience as an interpreter. But once I got hired here, I had to go for a 40-hour course in medical interpreting. Different world, okay? So, I mean, you don't know. All you see is this person do. You say to the patient, you have to go for a colonoscopy. He signs, so you have to, that. Wrong end. I'm just saying. It can happen. It can happen. So, that's another good reason you mentioned you don't know. How do you know if this person is qualified? Okay, let's think of one other. Please.
What I would say to be on the safe side, even though they may sign that they do not want the multi-theory interpreter, couldn't it be to be on the safe side where the multi-theory interpreter there and also that person who are there to be on the safe side?
Okay, that question has come up, but when if that happens, let's say if you couldn't hear her, she's saying, okay, they signed that they're going to release the hospital, but why couldn't a Monty interpreter still be in there just in case? It causes confusion. It causes confusion. Because I'm standing there, I'm seeing you signing it wrong. No, it's no, what are you talking about? I said it right. No, you didn't. Especially when there are egos involved. You're telling me that I can't sign for my daughter? I've been raising this child for 15 years. You're going to tell me I'm wrong? All kinds of problems come up. So we just leave. You're on your own. You're on your own. But it's a good point. It would seem like it would work that way, but it doesn't. Please.
You mentioned that there's rare scenarios where it's like a walk-in or emergency situation where you don't know ahead of time, but in the rare occasion that it is like a walk-in and they do decline, I'm guessing the resource that they have available in the ER might be available to like outpatient walk-in centers, only because...
Yes, it is, and I'm going to talk about it, but again, they're declining any interpreting services from Montefiore. I want my mother to interpret for me. So,
try to convince them otherwise.
well, as you would say, we would interpret, but we would ask you, and if you don't remember all the points, we'll help you, but we will explain to them all the risks, okay? You don't know if this person is qualified, a HIPAA violation, all these different problems, we'll explain this to them. And if they still at the end of the explanation, it's almost like the consent form, it's almost similar. This is the operation you need, but these are the risks. You still want it? Okay? We're going to leave. These are the risks if this person interprets for you. Do you still want to use it? Sign here. We're going. We're going to come. We're going to come. We're going to come. Okay? That's very rare that they're insisting and they're saying, I want this person, and we don't come. I've been here 9 years. It hasn't happened. And we've got to go. One more. Two more. Okay, you and then you.
Sometimes when people refuse to have a second person in the room, they won't refuse a second choice,
Yeah, right.
That happened when after the room was checked and determined as a man or woman.
Right.
We brought the one in.
Yeah. And we try to work with that too when we know like it's a certain type of appointment that it might be sensitive. But this, I'm giving this scenario, it doesn't happen often, so don't worry. It doesn't happen often. Most of the time, especially once I've arrived, they let us interpret. Okay? It don't happen. I've been here 9 years, it happened one time with me. Okay? But it can happen. So we have to go over this just in case it does happen. Okay? Please.
Can we use someone to
Okay, good question. Good question. Okay, good question. Hold that for 1 minute. I want to do this last point on why we shouldn't use this person. I'm going to come back to that because that's a very important point. One other reason that we shouldn't answer our phone during NAO is why? I don't know. That's a loud ring, too.
Don't look at me.
Oh, no, okay.
My mom.
I don't know. Check the pockets. It's a room. Has ever happened before, right? Okay. All right, I'm just going to try to, we're going to talk over it. Yeah, right, someone's calling me. Yes, right, exactly.
That's not going on the charger, it's on silent, it's coming through the speaker.
Oh, okay. Your room might be calling, you might want to. Okay. Why you didn't pick up? I forgot the. Oh, okay. Here's the last reason why. If you suspect any type of abuse, spousal abuse, child abuse, elder abuse, you definitely don't let this person interpret. Why not? They may be the abuser. They may be the abuser. Just imagine a deaf woman comes in, wife, and she brings her husband. He's going to interpret for her. She has a black eye. So she comes in. What's the first question you're going to ask this woman? What happened? How did you get the black eye, right? Okay, so you ask her, she does this. He answers. She says she fell down. You don't know if that's true or not. You don't know if that's what she said or not. You don't know unless you understand sign language. So you see the problem there? See the problem? So in those situations, we definitely don't let this person interpret. You call us, and we come in and help. Yes?
What happens if she refuses? Because in most cases, those like.
If she refuses again, it's the same answer. What can we do? We can't force her. She has the right. It's her right. We have her sign, and you're in wrong if she refuses. We'll encourage her, we'll explain everything to her, but we can't force her. It's her right. Just like the doctor can't force you to take the medication. He may think it's the best thing for you in the world, and if you don't take it, you're going to die. But if you say no, that's it. That's it. So in any type of abuse, you definitely call us, and we come in, and we help out. Okay? All right. Now, let's go back to the point she raised, because this happens a lot. And I'm glad you raised that, too. And this is going to be the last point. I'm going to end this because I'm running over time. Let's say you're in your area. How many here speak a language other than English? Speaking a language fluently. Some hands went down, but okay. All right. Okay. All right. We're going to use the Spanish example because it happens mostly in Spanish, even though I've seen it in other languages. So, patient comes in. The doctor says, "I don't want to call the interpreter. I have to wait for the interpreter." You speak Spanish, right? Come here. Interpret this for me. Come here. Should you do it? That wasn't too emphatic. What do you think? No. No, you shouldn't do it. Why? Why shouldn't you do it? Let me answer that question. Okay? Let me answer that question, all right? Because this happens a lot. You may be fluent in that language, whatever language it is. Are you sure you can handle medical things? Are you sure? Do you know what the doctor is going to say? Do you know? Let me ask you, do you know? You have no idea what the doctor's going to say, right? You can't control what the doctor says, right? So suppose you're in that situation, you're interpreting, and now the doctor starts coming out with things that you don't know how to interpret. You don't know how to say that test. You don't know how to say that procedure. You don't know. What are you going to do? Doctor, could you say something else? But I don't know how to say that. You can't do that. You're stuck. And if you're the patient, you're saying if you're the patient. Okay, well, we're talking about us staff members now, you as the interpreter. And here's the thing. In that situation, who's going to lose? The patient. The patient is going to lose. We had a situation here. Our Spanish interpreter was explaining, well, she's trilingual. She explained to me once, she was called in to do the Spanish interpreting. So when she walks into the room, the doctor's already in the room with the patient. And when she comes in, the doctor says, "Oh, I got it. We don't need you. I got it." And so she says, "Well, I'm here now. I can help you." "Nope. I got this. I can do this. I got it." And she says, "Well, doctor, I'm here." "No, I got it." He went on to speak Spanish. And our interpreter says his Spanish was horrible. Horrible. It was like junior high school Spanish. And the patient is there going, get. But again, who lost out in that situation? The patient. The patient. Why did the doctor insist on doing it? What'd you say? Ego. Very good. Ego. That's a sign for it. Ego. I got this. My Spanish is good enough. I can do this. I can do this. Don't let your ego get in the way of doing the right thing for the patient. And let me ask you this too. Do you want to be in this situation? I went to a workshop once, and they explained to us, they told us of a situation where the patient died because the instructions for the medications were misinterpreted. The patient died. That's how important the work is that we do. Do you want to be in that situation where possibly where you make mistakes and that patient goes home and suffers because of your mistakes? Not because of what the doctor said. The doctor told them right. You misinterpreted it because you were faking it. You didn't know. Do you want to be in that situation? No. You don't. You don't. So if someone asks you to come interpret for me, no. But here's the other side of that. If you are the provider yourself, let's say you're the nurse, and you speak Spanish, can you control what comes out of your mouth? Hopefully. Right? We try. You can do that. You can go ahead and provide the service in whatever that language is, the second language you're going to use. But again, only if you're qualified. Okay? So you have to ask yourself, am I real? And you have to be honest with yourself. Can I really handle this in my second language? Be honest. And if you can't, don't do it. Call us. We'll help you out. But if you really feel you're qualified, you can go ahead and you can speak the language fluently enough where they'll understand and there'll be no errors. Go ahead, you can do it. But you don't interpret for someone else.
I have a question.
Yes.
So, somebody comes from Africa. They don't speak English, Spanish, French, anyone. They speak this African dialect.
Yes.
And then they call me from ICU. The patient is on the line floor. So, for me to translate, is it okay if I translate for those people? I speak the language. That's my native language. I speak it very well. You know, but they're coming from different departments to go to the other floor. So, what do I don't know if they have their service. My people, they don't have the service to integrate. So, why?
Let's talk about it. Let's talk about it. Let's talk about, we're finished with deaf and hard of hearing in just for 2 minutes, guys. We're going to talk about a limited English proficiency patient so we can answer your question. Okay, what do we do for patients that can hear, but they speak a language other than English? You already know the answer. From any phone, you dial that phone number, 718-920-TALK, and an interpreter will be happy to assist you in how many different languages? 180 different languages, Mandingo's included. It's included. 180 different languages. So if they call you to come, you just tell them to dial that number. Okay? Dial that number. Okay? And the way it works is dual handset phones and splitters. You have one handset, you give the other one to the patient. Both of those plug into a little device called a splitter. Your department has it. And the splitter plugs into the telephone. All of you on the phone at the same time with the interpreter. Or you can just use the speakerphone. If it's a private area, just use the speakerphone. You don't need to use the handset. Just go ahead and talk. You'll hear the interpreter. The interpreter will hear you in 180 different languages. And I have to go back 1 second because I forgot to talk about the other device that we use for the deaf and hard of hearing. Video remote interpreting, which is similar. It's not similar, I shouldn't say similar, but when we can't come, or it's an emergency situation, a lot of departments are using this now besides all of our emergency rooms. Basically, it's a laptop or it's an iPad. Now it's mostly iPads. And the iPad is connected to the internet. An interpreter will pop up on the screen. You just go ahead and get started. The interpreter in the screen will interpret for you. They can see the patient because there's a camera in the laptop or the iPad. And you just go ahead and get started. But just understand, there's many deaf people don't like using that because it's small. They'd rather have a live interpreter. I had this morning, woman said, no TV, no TV. Okay. But in an emergency situation, you have to go and get started. Okay, you go ahead and do that. And if you're in that situation, like you mentioned before, and it's going to take us an hour or an hour and a half to get there, you offer this service to them. A lot of times they'll say, no, I'll wait. I'll wait for the live interpreter. But if they don't want to wait, you can just go ahead and use that service and just go ahead and get started. Okay? All right, so let's sum all this up because I know you guys want to go home sometime today. Okay. Always use an interpreter when obtaining the patient's medical history, obtaining description of the ailment or injury, obtaining informed consent or permission, giving a diagnosis or a prognosis. The patient is in an emergency situation, discharging the patient, explaining procedures, tests, treatment options, or surgical procedures, explaining prescribed medications, the dosage, instructions, side effects, or food or other drug interactions, reviewing follow-up treatment, therapy, test results, or recovery, or providing mental health evaluation, therapy, counseling, and or other therapeutic activities. So, in other words, when should you use an interpreter? Always. Good, always. Here's our phone number during the day, the interpreting services number. You're not going to call me. You're going to call interpreting services, 920-4943. Before or after hours, the guys are going to talk to you about the intranet. The interpreters are available 24/7, 365 days a year. We are always working. Anyway, but we are available anytime. So on the resources page, our phone numbers are there. You just call us and we'll come. And if all that fails, the ADN or the ANM, or just dial 0, and they'll definitely get in touch with us. Okay? So, I want to thank you all for your attention and welcome to